Dr. Wan Rizal. Question 12.
Question 12, please.
Mr. Speaker, the Task Force on Child and Maternal Health and Wellbeing was set up by the Ministry of Health early last year to oversee the development and implementation of a 5-year strategy and action plan. The strategy will focus on supporting women and their children to attain good health and well-being, leading to a healthier next generation. The efforts of the task force are organized along 3 main thrusts. First, we are focusing on translating evidence-based findings into policies and programs to address health risks. We will go further upstream as early as the pre-conception phase in implementing preventive health efforts for women and children. Second, we're reviewing service delivery for children and their families to minimize the number of touch points that our citizens need to navigate across services. And third, we're reviewing our approaches to engage stakeholders and the public and to hear what matters most to them and to ensure that our messages and support to them stay relevant. Over the past year, the task force, comprising members from the public, private, and academic sectors, have conducted focus group discussions with parents, parents-to-be, and caregivers. We've also conducted some 20 site visits and engagement sessions with frontline officers from across the health, social, and education domains to better understand what matters most to children and their families. The task force is reviewing all this and finalizing its recommendations for the strategy, and we'll be announcing the details soon. Thank you, sir.
Dr. Wan Rizal.
Thank you, Mr. Speaker. Thank you, SMS Janil, for sharing with us the plans for this. I think one of my SQ would be really the involvement of the paternal part of this program, because we do understand that although this program looks into the child and maternal health, we do see the importance of fathers in this role. And I hope that we could see more inclusion of fathers in the program and other plans for this that include including grandparents also. My second SQ will be actually we talked about screening as part of this program. With more screening, inevitably we'll have more intervention, most probably. And we talk about intervention, I would think that there is a need for the task force to engage the workplaces, and are these in place, and for them to provide increased workplace support for mothers in the future. Thank you.
So I thank Dr. Wan Rizal for his questions. For the first question, which is paternal and grandparent involvement, the answer is yes. We are looking at this from a mother and child view with respect to the science, because that's really where we have the research in terms of preconception, what happens in pregnancy, early neonatal period. But getting things done, the service delivery, the kind of programs and activities are really from a family-centric point of view. And so the whole family is indeed encouraged to join in, to be part of this, and to come along the journey. I hope that the fathers out there don't need a special invitation with their name. We're asking the whole family to turn up. So as a father, as part of the family, please come and get involved in looking after the young child and the young child's mother, and helping to support them through this journey. The grandparents are naturally involved and very much part of the caregiving in our society, and so we take a family-centric view to involve the whole family. For the actual strategies around screening and interventions, these are still being studied, and we have to look to see where we will implement programs and activities. We'll make the announcement in due course, but indeed getting the right tools to make sure the interventions are effective are going to be important, and we will be studying this. Thank you.